Garcia, one of the sports shoulder surgeons here. Today we're going to show you a patient testimonial. 56-year-old unfortunately suffered a pretty bad shoulder injury, had fractured his shoulder in multiple pieces, and actually had split part of his head, or the ball in the socket, to the point where it was likely not repairable. So we had a long discussion about sort of the best options for him. In the end, I like to make my patients have a decision-making process in it too. We decided to go with a reverse shoulder replacement for him, given the amount of injury he had. He turned out to have a very, very good outcome, and he's back to almost all activities, and hopefully you can see his result and how he feels about it. Thanks.
So the emergency room told me it was bad, but from there it was a piece of cake. I mean, it in terms of not necessarily putting me at ease, because I didn't know I have any expectations, but I had a great feeling I was in good hands.
Okay, perfect.
And Dr. Garcia, I think, had reached out to just about everybody in his orbit who had a say in this one, and to get some opinion on it, because I think, being a young person, and they don't typically do that on younger folk, I guess. So it was about 50-50, I think, if I remember right, to have that partial or to go full bore and do the total reversal. And one thing I will say for Dr. Garcia, I was trying to get him to lean one way or the other, and he wouldn't. He was leaving it to me, but laying down all the options. And I think that 50-50 bit, to my thinking, if I was going to get 25 years out of a total reversal with a 56-year-old man, that puts me at a pretty old age before things start to happen. So that was kind of what swayed me, and I'm glad I certainly did it.
Great.
I didn't realize how well I was gaining until I saw you, Dr. Garcia, and how far I had improved. I think I mentioned earlier about the positive reinforcement of it, but in great care. I mean, that certainly, the goal was to get back to some level of activity. I think you had mentioned I could play all the golf I wanted, which I already played all the golf I wanted 3 or 4 times a year, but to be able to swing a golf club or to shoot a basketball was one. I think those weren't necessarily goals that were out there, but they were in my field of vision. Everybody tells me that I went beyond where I should be. I feel great. I feel great. Actually, just shot a basketball for the first time on Sunday, and as far as you know, it went well. I mean, I could get to the rim with the basketball. That's 10 feet up.
Yes, exactly.
So yeah, it's really going well. I'm more than happy about where things are at. Again, without knowing what to expect, but then in terms of what you were telling me and what physical therapy was telling me, I think I've more than exceeded expectations. Absolutely. I'm what's better than happy? Giddy, I guess. But yeah, most definitely.